Hello, everyone. It is 7:31 p.m. on the 12th of January, and we'll call the Board of Health to order. Happy New Year to you all. Thanks for joining us tonight. We'll start with approval of the past meeting minutes from December. If everyone had a chance to review those in our emails, be happy to accept a motion to accept or any corrections.
Motion to accept.
Second.
All right. Any opposed? All right. Hearing none, the minutes carry. We'll move right into Sandra's report.
Sure.
Welcome back.
Thank you very much. So I appreciate the board's patience with the department. As you know, I've been out for several weeks of the last 6 or 7 months, and so it's good to be back. I'm thankful for Santina and Rob and Sarah that kind of kept things running. Didn't call me at home, just let me recover. So that was good. I appreciate that. So this, I see it. This past month is, this month tends to be in some ways a slower activity where lots of people are taking time off, for the holidays. So we kind of don't move forward on a lot of big projects. We're more like sort of just tactical and taking care of the day-to-day as people are out. And so there hasn't been any largely significant activity, but I thought I would share some of the things that have been going on, like I like to do sometimes. I'll start with, I just thought this is interesting. I would share this. This is the flu, it's called FluView from the CDC, and it's a weekly map. This is starting in October 4th, and it walks you through like each week of, this is the green is, you'll see is little activity, and let's see, I guess I think this one's play. And it moves forward a week at a time, and you see as it gets redder and darker and purpler, and then all of a sudden you'll see 50, 51, 52, and then you can kind of see, here it's things are still good, then week ending December 20th, there's a big change. Week ending December 27th, significant, and then this pulls back a little bit. You see a lot of the reds go back to yellows, or some of them. Still a lot of activity in most of the areas of the country. CDC today on a call said that they're saying don't be too hopeful about what it looks like, in the sense of same thing in the Connecticut. If you see like the influenza activity, it looks like it's coming down, but they're thinking that's a reporting issue, and that they're not convinced that we haven't seen all of it yet, but they said there are some signs. It looks like it's slowing, but it could just be a reporting issue.
Right, anecdotally, I'll say it's getting much better in the ER. I mean, it was like the Monday of Thanksgiving week where it just arrived, and then it hit really hard through December, and now we're just not feeling it like we were. So maybe we are going the right way now.
Yeah. It went, like just anecdotally, like through several members of my family right over that Christmas week, and just everybody was wiped out, So in Connecticut, you'll see, this is influenza here, that, again, it looks like it's coming down a little bit. Usually this last bar or two, you can't really rely on much. RSV, you'll see, same kind of thing, still kind of going up. COVID, we had a peak in September, and we see some signs of leveling, December, end of December, early January, with COVID. And then this one, you can see compared year to year, with dashes being 23, dots being 24, and solid line being 25, COVID, influenza, and RSV. And you can see that we're under where we were last year for COVID. We're above where we were last year with influenza. And we're under where we were last year for RSV. And so just thought I would share some of those. At the CDC call today said they're categorizing this so far as a moderately severe flu season, where last year's was considered severe. So far we're less severe than the previous year. And they said relatively low vaccination rates this year, 42% of children 45% of adults were vaccinated for flu this year, with those same numbers for COVID being 6.9 and 16.7, so very low utilization of this year's, the latest COVID vaccination. This month, we continued with our vaccinations. We did, again, December's a slow month, but we did 62 vaccinations. We did 2 additional home visits where we go to people's houses, homebound individuals, and offer vaccinations to anybody in the household. So we're up to, for respiratory vaccinations, we're up to 846 for the year, with 1,283 regular flu, 380 high-dose flu, 182 COVID, and we've been to 24 homebound visits. So those vaccines are included in those numbers, but we've been out to 24 people's houses to do it at home. Some of the things that are happening at this year and at this time at the department, we've had all the staff of the town have had to complete 4 training modules on cybersecurity. So we've been, having that, everybody taking time to do that in the office. We've had the certified food staff, so that's 6 of us, 7 of us, 1, 2, 3, 7 of us. The certification renewal period is coming up, so everybody's doing their last needed CEUs. So there's a lot of FDA online classes that the staff are hunkering down and doing. I still have some to do for myself, but we have until mid-February to complete those. I came back on the 10th of. I was going to talk about the measles in the U.S. The large outbreak in Texas they declared over in August, but we still had a total of 2,144 cases of measles in 2025, with 3 deaths in 45 jurisdictions. There was 45 outbreaks that happened, different clusters, and 80% of the cases are outbreak associated. So far in 2026, there's been no additional outbreaks, but there have been 3 additional cases related to the existing outbreaks that were happening. And so the big question is, are we, measles was considered, under control back in 2000, and there's potential that this year we'll lose that designation. They're still, the CDC said today that they will, it'll be a while before they figure it out because they have to document chain of transmission. So the idea is it's been continuously transmitted for over a year, and so they're still working on sort of the research behind that to say, did this actually connect to that outbreak, and did one cause the other? So they said it'll be a while before they totally figure that out. When I came back on the 10th, my first day back, it brought back memories of my first few months in office as director. Was the H1N1 pandemic. I remember it being like, okay, here we go, starting right off the bat, dealing with a pandemic and having some of the first cases in Connecticut in Fairfield. But when I came back on the 10th, they did make an announcement, DPH did, that they had the first measles case in Connecticut. And so there was a whole series of calls at that point with Connecticut Department of Public Health, and at the direction of the Connecticut DPH and the Attorney General, I'm not at will to share much other than what's been released, but I can say that lots of health departments on those calls received assignments to do contact tracing and verification of people's immunity status, and did active monitoring for the 21-day period. And so it was a lot of work going on throughout all of Connecticut related to this. And, to date, there has been no transmission. And so we'll remain hopeful in that regard. And then other activity the department's been involved in. So as you know, I sit as a member of the Board of Condemnation. We continue that work, and we currently have, in at least the last agenda, 11 active properties that we're looking into. That we have, with 2 of the properties, we've been working pretty extensively for a long time with the town attorney to negotiate an agreement with the attorney of one of the owner of a couple properties on our list. We've finally reached an agreement, and that agreement was approved by the Board of Selectmen. It's a negotiation of the fines related to the properties, with the condition that that the properties, within 60 days of the agreement, be demolished. And so we're hopeful. These are some properties that have been sort of blighted for a long time, and we've been trying to work it out. And the fines did not work, until now. And so, but we're pleased to enter into this agreement. So it was, the Board of Selectmen approved the agreement on December 17th. So we have until February 15th they have to demolish the properties, or the fines revert back to the original fines if they don't demolish the properties at that time. And so they're fairly significant fines. We did have also, in addition to the meeting that we had a separate citation appeal hearing. So we did cite another property for blight, which is the $100 a day fine. They appealed that citation. We had a citation appeal hearing with the town hearing officer. And while the defendant's lawyer made many approaches of how our methods were not valid, the hearing officer basically said, listen, I'll give you 30 days to take care of this issue, or the fines go back to when the citation was issued. And so what's in a sense, it's a staying for now, but it's ruling in our favor of working to resolve these issues on these blighted properties. This past week, I met with the First Selectman's office and the Finance Department to review their budget for next year. We are largely level this year, with a couple of exceptions related to, in the past couple of years, there have been 2 union contracts ratified, and so that changes pay scales. And what happens is they sometimes, 2 things. They don't put into, when there's a pending negotiation, they don't put into the budget a dollar amount. They put it into a contingency account with other dollars to say, so they don't tip their hand to say, hey, we put in 3% for this union. They just say, hey, this money's in a contingency account. We think it's going to be in this range. And then what's happened to our budget is that while it looks like a large increase in salary, it's actually 2 years of increases, and back the contracts hadn't been resolved for a couple of years, so they're larger increases. And then in addition, some of those changes impact things like our overtime line item is going to go up by about $10,000, because the nurses were viewed previously as salary, and then during this negotiation, with the advent of Paycom, the new payroll system, they went to hourly, and then they work 37.5 hours in the school. So if they do any meetings or other things outside of that, it's billed as overtime. So that has an impact on our overtime budget. And in addition to the other union, it was clarified that certain days are eligible for overtime, which they hadn't been getting paid, and so now that's clarified, and so that has a slight impact on our overtime. So things like that. Our sub budget for sub nurses will go up because the rates increased, and so we're seeing some increases all related to those settlements of those agreements. And we are requesting one additional position in the nursing program. And so we've proposed that to the select person's office in the finance department, and they're considering it now. We don't have any answer. They, sort of ask, if you're asking for any new position, submit it by this date, and we'll review it and get back to you. And so we've done that.
Is that an additional school or additional nurse?
It's not. It's really, we're proposing adjusting the staffing, in a way, but it would be considered it would be a new full-time position. And so we'll wait and see. We'll either hear from the first selectman's office again and meet with them again, or we'll go to the Board of Selectmen and they'll present the first selectman's budget at that time. Usually, if there's any significant changes, they'll get back to us prior to that. We continue to meet with the Fairfield Safe Streets Alliance, both in December and January. December, we reviewed survey results. We did an online survey. We got almost 2,000 responses regarding safety, pedestrian and bicycle and walking safety around town. And they are, we reviewed that, had a presentation from one of the authors of the survey, and are going to be working on a new webpage that presents those, and with the hope of that provide some qualitative data to support some of the programs that we're looking to do in the future, and projects that they're looking to do to improve street safety in the future. And then this month we started planning for sort of some of the projects and educational activities. And so it looks like we're going to be doing a short video for middle school students on, e-bike and e-scooter safety, and talking about that. And there was I think Santina shared last month, there was a forum on December 4th with I think it was an ER physician that presented, talking about the injuries that they see. And so they're going to try to have that individual sort of prepare some of the video, and along with the police and accident photos that they have, to make a very short but powerful presentation to the middle schoolers, so that they can do that, as well as an educational component for parents. One of the surveys and at the forum, people were, parents didn't understand the scooters and e-bikes fully themselves and the laws and rules related to that. So they're trying to prepare some kind of educational component for parents to say, this is how to talk to this is some of the topics to talk to your child about when you see these types of e-scooters and e-bikes and that type of thing. We are preparing now for Heart Month in February. So Santina and Julie, our public health nurse, are doing 5 screening events for Know Your Numbers. So we do, blood pressure, weight, A1C, cholesterol, BMI, a few others. And so the idea is teaching people to understand what are your numbers and understanding your trends, what direction are you moving, and all those variables with those numbers. So we'll do that on the 4 Wednesdays in February, 4th, 11th, 18th, and 25th. Plus we'll do an additional one for town hall employees. We usually do it in this room. Just, they can sign up online and don't have to travel for it.
Since where are the other ones?
They'll probably be at public health and nursing. So just like our flu clinics, at this point we just do flu clinics at the nursing office. And so people would sign up and attend there. In addition, we are planning to do a hands-only CPR challenge, of getting people to watch these very short videos and learn about hands-only CPR and complete a 2-question survey that, yes, I watched the video, so we can sort of generate some training for what we call our spontaneous responder training series, where those people who are responding in the community, that they're better prepared to respond with even something as simple as hands-only CPR. With the environmental program, we continue to meet with, we have an attorney assigned by the town. We're taking civil action against 2 properties for which we issued orders. We have elected not to go down a criminal pathway, in the sense that, you know, we met with the prosecutor, and the prosecutor felt like this is more appropriate to take a civil pathway, so we have an attorney assigned to us by the town attorney. We've had several meetings with this attorney who's negotiating with the attorneys of the owners of these properties, trying to reach agreements. And so it's a lot of, you know, a lot of phone conferences and talks and back and forth trying to get things done. But we feel like we're slowly moving forward with some of them. And so, but that is enforcement. You know, it's sometimes doesn't happen. You know, when people don't do what you say, what you tell them to do, it's a little tricky sometimes to get them, the courts to compel them or, you know, agree to do what we're asking. And so we'll continue to work on those, one of which is an overcrowding case, and another one is just housing conditions. We continue to have, you know, almost weekly municity database transition meetings, and so we're planning to go live in March at this point. You know, they had said we're going to be live by December, early December, but it didn't make it, and so we'll wait for March and see what happens in March. And then Santina mentioned she and Julie were doing a Flu and You program at Fairfield U Child Center, the Eli Center, and so they did that and had 26 students and staff there to participate in that, and book reading and a hand washing demo with the Glow Germ, which they love, you know, turn off the lights and their hands glow. And so that went well, they said. And then this past week we had the First Selectman's office organized a legislative breakfast with, you know, Tony Huang, Krista McCarthy-Vahey, Sarah Kitt, and Jen Lieber. And it was very good. They, you know, all the department heads and First Selectman's office staff are there, and just basically get a chance to hear from the legislators of what's happening this session, what do they think might impact the towns, and to hear from the department heads about programs and regulations and discussions and amendments of things that are harming them. You know, that things like, you know, there's some allowances for buildings to have one exit, and that impacts the fire department, you know, and from, you know, things related to the state changing interest rates on tax, delinquent taxes or late fees on taxes, and people not understanding that. And, you know, so it has, you hear about all these unique implications of changes that these regulations that get passed have at the local level. And some of them are unintended, but, you know, it's some of it, you know, impacts business, slowing down permits and things like that. When certain things require an additional review by the state, that slows things way down. And so, but it was a very good session. Had a couple hours with the legislators to hear from us. And so I thought it was a very productive morning. So that is what I have for now.
That's a lot.
Yeah. I did just want to say I didn't announce myself at the beginning because it was like a minute into your talking and didn't want to interrupt. But I am on the call.
Great. Thank you, Sally. Thanks for coming.
So Know Your Numbers is every Wednesday in Feb.
Yeah. And so you'll see it on our, well, probably next week it'll go up on our social media and get pushed out there. We're just working on some of the, whether we're deciding whether to do the challenge as a, just internal to the town, or whether, you know, we are going to lay down the gauntlet to other health departments and see who can get the most
views of the video.
Most views of the video, people saying, hey, I watched this training video on hands-only CPR. And so, but I think some of those other health departments would, you know, try to rig it, you know.
Oh, okay.
So we may just keep it to us, no. They're
Are you gonna
still,
name names?
they're still sore from the last survey that we did where we more than double anybody
Their
else's
response
survey
rate?
response.
That's great.
I
Yeah.
can believe it, 2,000 surveys for the State Street.
Oh, I can.
Yeah.
And people are,
Yeah.
I'm like
They had
begging people to
opinions.
make
Bad,
surveys.
yeah.
Oh, yeah, I just had two kids an hour ago pass me on Post Road going the wrong way,
Mhm.
around, two kids on each bike, you know.
it's, I think,
Yeah, I
front
think
of
there's,
mind for
yeah,
everybody.
it's, you know, it kind of in the last year or so, it kind of exploded with, you know, the private ownership of these
Mhm.
electric bikes and electric scooters and the speeds and the whole.
And the variability in the speeds too, like one product could go, only up to certain miles per hour, but another one can go much faster, so it's
Well, and
hard,
there's
it's really hard to,
videos on how to remove the governors on the ones that are
no.
slower. And so they can go, and a kid can go online and figure out how to, you know, adjust it so that it allows them to go a lot faster.
Mm-mm.
And so I mean, I think everybody feels that concern, for the kids and their safety and, you know, so we're hopeful that this effort will continue. I think it's, I remember we did our first, presentation. We brought in a speaker from Massachusetts. It was a urban planner, type of individual that came down. We had it at the Fairfield Theater Company, Stage 1 area.
Mhm.
And Sarah Lethe, our health educator, organized it. But, you know, we had, 100+ people there to learn about, traffic calming measures and, the benefits of sidewalks and, and so while it was a good response, it was, people were like, really? It was still almost the attitude of streets are for cars back then. And so we're a long way from that now,
Mhm.
some 10, 11 years later, where we're getting 2,000 responses to people saying, we want the roads to be safer, we want the streets to be safer, we're willing to, to put forward these measures of, the traffic circles and the, things that help slow traffic and, so we're hopeful and we'll, again, the selectperson's office is behind this and we're going to continue to work and put on educational efforts and, and it's not just that. I mean, it's not just Fairfield State Streets Alliance that's doing the work. There's pedestrian bike committee, there's engineering department has been working on these things for years and has a whole pipeline of projects that they're working to get funding for, to improve these things, and every time, anytime we can, we've helped pay for sidewalk extensions and sidewalk connections in certain neighborhoods, and so we'll continue to try to do our part in that, when we can get funding for those things. But, keep going.
Thanks. Any other questions for Sands? All right, thanks for your report. Any communications from anyone?
I have none.
Same. Any old business to discuss?
We do not.
Any new business to discuss?
Nothing on the agenda.
Well, with that, we have no other agenda to follow, so do I have a motion to adjourn?
So moved.
All right, second. Any opposed? Hearing none, we are adjourned at 8 o'clock exactly.
Okay. Well, thank you, everybody, for coming out on this cold night.
Thank you.
Thank you, welcome back.
Welcome
Thank you.
back.
Thank you.